Welcome again. Hello, and I have a pleasure to introduce you to Bleddyn Rees, who is chair at the Digital Health Society. He will moderate the session on Vaccination Information System. What does good look like? Bleddyn is an experienced commercial and international healthcare lawyer with over 30 years of experience in advising on outsourcing, privatization, complex contracting, and projects. And he's a deputy chair of the European Connected Health Alliance and chair of the Society. As you already know from our introduction, both of those organizations are helping to transform health and care services internationally. Bleddyn chairs the digital working group of All Policies for Healthy Europe, a think tank set by Johnson & Johnson, Microsoft, Philips, and Randstad, based in Brussels. Has a special interest in digital health, health data, and medtech. And is the mastermind behind the roundtables for the Digital Health Society Summit, where also the vaccination systems was one of the recent topics. So I cannot think about a better person to moderate, to facilitate this session than Bleddyn. So Bleddyn, the floor is yours.
Carolina, thank you very much. And if we can share my, hopefully you now see my slides. Yes. Okay, so very quickly, some quick signposting of what we're going to do in this session. So I'm going to give an introduction to the panel and to the calls to action. We're going to have a presentation from OpenSky on the state of art in electronic vaccination registries in Europe and the UK. And then a summary of the recommendations of Roundtable 5. And then some observations from Cristinela and William. So let me start with an introduction to the panel. So first of all, delighted to welcome Professor Dipak Kalra, President of the European Institute of Innovation through Health Data, and my collaborator on the Roundtable program. Secondly, Cristina Velicu, who is the Director of Vaccines Policy at MSD. Thirdly, Professor Tudor Pitulac, who is the Research Projects Division Manager for OpenSky Data Systems, and William Flanagan, who is a Director of OpenSky Data Systems. So calls to action, and I'm not going to spend long on that slide. So the first thing to really talk about is the calls to action program, and in front of you, you see the 7 calls to action which I just mentioned and read out in the introduction to the second day. So all I'm going to focus on in here, in relation to the Immunisation Information Systems Roundtable, the 3 calls to action that were relevant were 2, generate value and trustworthy real-world evidence, 3, accelerating interoperability in Europe and globally, and 7, adopting a transformational approach to health data. So moving us along quite quickly, what's the backdrop, if you like, to the calls to action? And I'm not going to spend much time on this, but I'm just going to give you a feeling for why the Roundtable program was started. So first of all, there was this growing need for large-scale access to health data. Much of this data needed to be fine-grained, individual level, close to real time. It needed to be longitudinal, reflecting health, wellness, disease trajectories and outcomes. And there were large-scale data resources, both in Europe and globally. There was a need for alignment. And again, looking at vaccinations, the relevance of this were the different kinds of data, different data standards, and very much around sharing the value of this intelligence across borders. So if you think about our numbers during the pandemic, that's another example of why this type of data became so important. But then what were the catalysts for aligning some of these variations? And in the European context, there were four, which was the General Data Protection Regulation, the European Electronic Health Record Format, the pandemic itself, and then the European Health Data Space, which is by far now the largest catalyst in a European context for further alignment. So a little bit about the roundtables in terms of stakeholder engagements. Started in 2020, and then in 2021, we had the first 4 roundtables, which you can see on the screen, the subjects. I just wanted to emphasize that they were developed and run by DHS and IHD in a neutral and independent way, and that we had this collaboration and coalition with industry to make them happen. But the important thing to understand was that these roundtables are multi-stakeholder, involving between 20 to 35 experts from industry, academia, healthcare professionals, patient representatives, organizations, and regulators. So a really broad base of experts to try and understand the issues and suggest recommendations and solutions. So Tudor, at this point, I'll stop sharing and let you give your presentation.
Thank you, Bleddyn. Hi, everyone. Happy to be part of this very interesting event.
If you can go to presenter mode.
Okay. Okay, can you see it now properly?
I'm still seeing the slides down the side of the column. You just need to go to the lectern symbol at the bottom to get it to
Sorry, I will try again.
That's it.
Now can you see it properly, or?
No, I'm seeing your home screen, I think.
Oh, yeah, I'm trying to.
So I'm seeing the slide, yeah. Great, that's it.
Okay. Sorry about this technical hiccup. Okay, so I will briefly present the results of the first phase of a more encompassing research, which actually started more than 1 year ago. It's the brainchild of Cristinela, and we are really happy to be part of this very interesting journey. MSD selected OpenSky Data Systems to do this research because we have OpenSky Data System, and William personally developed the schools immunization system in Ireland, focusing from the beginning to HPV vaccination. So we are in a very good position to do this landscape in Europe, and as you will see, not only in Europe, to understand the state of the art, and of course to identify best practices, to circulate and to try to upscale the electronic vaccination registries in countries where those are not very mature yet. The summary report for the first phase will be available soon, and you'll receive, it will be widely disseminated, and it will be not, I don't know, a final step, but starting point for discussion, and of course for improving the results. Regarding the key takeaways for today, so I will briefly I will present the project goals, the methodology, of course, the findings, and a few words about next steps, and a glimpse of the results of the second phase. Well, from the start, the project goal was to map the state of the art of EVRs across EU and UK, identify the best-in-class electronic vaccination registries in place for offering rapid and reliable information on VCRs, because this is the ultimate goal, how to increase the vaccine coverage rate in as many countries as possible, and of course to support the European device in terms of preparing and using the EVRs, and of course issue recommendation for overcoming the cleavages. The discussion at the beginning was to identify the current state of the art in EVRs, as I said, in EU and UK, emphasizing especially on HPV vaccination, and to perform an in-depth analysis of registers in several countries selected. Afterwards, we saw that it's important to have those two set up in two different phases, and they are complementary approaches, but they need to be in distinct phases of this research. So after preparing this scorecard and heat map in the first phase, the idea is to use all the findings and lessons learned to inform decision makers on the possible ways to increase the VCR in the EU and UK. And this is the activity today is it's a very important opportunity to do this. Of course, to perform the in-depth analysis of the electronic vaccination registers in several countries, and of course to design a virtual model of this desirable common EVR architecture, and of course to integrate relevant features in the EVRs in use. Regarding the methodology, we prepared some instruments. We tried to have a large number of interviews with people in all the 31 countries and territories. It's proved to be too much for the first phase, so we decided to focus mainly on desk-based research. We prepared, of course, a sheet for data capture, and for each country we prepared an algorithm using 10 variables, and of course we generated a scorecard and create a heat map, as you will see. Before entering a bit, before presenting the heat map, a few words about the key learnings and recommendations. So definitely the existence and relevance of the EVR, or the maturity of the EVR, are crucial for a higher VCR. So we have a clear direct correlation between EVR and VCR. That is correlation, not causation. We can discuss about this hypothesis that could be some causation between the EVR and the VCR, but this is only, as I said, an hypothesis. It is clear that there is a correlation between the maturity. The higher, the more mature an EVR is, the higher the VCR in a country, which is relevant. In all countries, there is a will to increase the vaccination rates, which is extraordinary. In all countries as well, there are ICT solutions in place for registering vaccinations. Of course, the maturity level differ. Sometimes inertia plays a particular role in delaying the implementation of new ways of registering vaccination. When there are countries where the old fashioned ways of registering vaccination are working well, at least at some point, and they don't have, I think, enough incentive maybe to switch to intensive use of ICT in this area. The opportunities offered by the European Union, especially European health data space, must be utilized. And of course, there is a need for an EBR template in Europe. And we discussed about this minimum common denominator to allow interoperability, or the gold standard, as we prepared lately to call it. This is the heat map, and we have the scorecard as well. I will access now the Power BI just to present the results briefly. Having this results in a graphical format will give us quickly a glimpse of the situation now in Europe. Okay, we have separately for UK as well, but it's not now the issue to use this one, but to have an image of what is happening at the EU plus UK level.
Tudor, we're just still seeing the heat map at the moment, just so you know.
Okay. So I'm back to the Power BI. You cannot see it now.
No.
Okay. Can you see now the
No. And
the Power BI?
No, I'm afraid we can't. And you're not in presenter mode now either. We can just see the slide pack down the left-hand side of the...
Oh, this is again the same issue at the beginning.
The wonders of technology.
Yes, but it's, yeah, this is when you go from PowerPoint to Power BI sometimes. So maybe it's better to stop share for a bit and then
Reload.
share my screen again.
Mm-hmm. I think give it one more try and then just perhaps carry on if you can't get it to work.
Okay, I will, in this case, maybe just to, maybe it's, can you see the presentation now again?
Yes, I can. Yes, I can. Thank you. We're back to the heat map now.
Okay, you can see, you can go to Power BI now.
Yes, we are now seeing Power BI.
Okay. Good. As you can see here, there are two cleavages One is between the northern countries and the other countries, and the other one is between the western countries and the eastern countries. Following this, of course, we developed other, we applied other filters and to see other correlations. But you can see here that there are information regarding each country, and of course there is a dashboard for each country. I hope we'll go back without other issue this time. Okay, we're able to identify, as I said, this strong correlation between maturity of the EVR and the higher VCR. I will continue now with the presentation. Few of the conclusions. There are relevant variation in using the ICT for vaccination in Northern Europe, as I say, compared with the South, and in the West, comparing the East. There is a certain correlation between the EVRs and the VCRs, and there is definitely this conclusion that the common approach of the EVRs would make a difference. Regarding the challenges, well, the variation between EVRs in use are substantial, and it's very difficult, as it's happening usually with the health data. It's when you are using so many standards, it's difficult to correlate and to make those systems interoperable. The strongest EU countries are difficult to influence, and they have very specific approaches in this area. So if you are talking about France or about Germany, as I said, it's quite difficult to convince them to change something, because in France, for instance, they have a very specific and bureaucratic, but system that works. In Germany, they have this specific ways, traditional, if you want, ways of registering the vaccination, and they are quite reluctant to make changes. Well, the registration is going well, but when we arrive to the reports, well, you can see that are relevant delays in reporting the vaccination rate. Maybe you can have maybe 2 years delays, which it's really a problem. And of course, there are technical constraints in making those systems interoperable, but let's say those technical constraints maybe are the least problematic issue on the map. Of course, there are opportunities. The focus on of the European Commission on digitalization. There is an emphasis put on interoperability. This is happening not only in the health area and in vaccination area, but in a lot of other areas. We have some quantitative results, relevant quantitative results in the past 15 years in vaccination in general, in HPV vaccination, especially if you want. And there is time, I think, for this qualitative leap forward. And of course, we have these practices catalyzed by the COVID-19 pandemic, and we really are able, I think, to build on that. Regarding the next steps, of course, there is very relevant to have more countries landscape to assess the Nordics architecture, because you saw that there are countries in the north that's scoring, the highest in the scorecard. So the assess Nordic architecture and integration with cancer and screening registries create this virtual model of a common EVR, assess driver and barriers at the country level, and of course, activities like the one today. Well, because we are toward the end of the second phase already, regarding to adding more countries to the heat map and to the scorecard, we already have analyzed 3 other countries, non-EU, non-UK, meaning Norway, Serbia, and Switzerland, and we are moving forward with countries in Asia Pacific. So this heat map would become, like a world map in time, which will be extremely interesting and absolutely useful. Of course, we created the virtual model of this common EVR. It's a so-called gold standard, and we analyzed most of the countries in the north against this, so the systems in these countries against the virtual model, against this gold standard, using those 4 levels at the individual level, being them the people which is working in the health system, or citizens at the population level, at the state level or intergovernmental level, and of course with other third parties in industry, research, academia, and so on. And it's very important to see this integration of the, especially from the point of view of HPV vaccination, the integration with cancer and screening registries, because this would allow everyone to see how relevant is to have a higher vaccine coverage rate for HPV in reducing the incidence of a specific cancer. So going toward the end, the interest of the matter is consistent everywhere. The momentum for action is here. As I said, it is time for a qualitative leap after so many years of accumulating relevant quantitative results. As I said, it is this relevant direct correlation between the maturity of the VCR and the EVR and the level of VCR. And definitely interoperability is a tool against the divides. And of course, during the second phase of the research, we saw that, not only that the more mature a system is, the more information are available on the system, but as well, the more mature a system is, the bigger is the interest in improving it, in making it better, But the idea is for the third phase of the research, and maybe even further on, is to bring all systems in Europe at a minimum level of maturity that to influence the VCR positively. So this is the hope that we have, that it will be possible, and we already are working in this in another phase of research with several countries that has been selected. Thank you very much. Sorry for the technical hiccups with the Power BI, but I think it was worth your time. Thank you.
Okay, thank you. And whilst we change slides, I'd just like to say that what this was really doing for us was providing the backdrop for the round table. So we had this rich data coming from the OpenSky report on a country level, and then we assembled the usual round table experts for this coming from all stakeholders. And then I'll hand over to Dipak to take us through the recommendations.
Bleddyn, thank you very much indeed. So just to add to your little piece of context there, the group that we assembled included particular stakeholders from certain professional groups or decision makers, but we also included deliberately the World Health Organization, because although our focus is European, this is a topic that really is a global topic, and we valued their input. And the roundtable experts were really taking on board a number of things. One was the OpenSky report you've just heard, and what we saw. Tudor was very careful to speak about a correlation and not a causation, but it was irresistible, I think, for our experts to feel that there was within that report an implication that national investments in having better immunization information systems would bring value to society, including coverage rates, but also intelligence sharing. Secondly, that we were all still learning a lot from COVID, but there were things about the way in which Europe did and at times did not cohere well around COVID intelligence that we could learn from. And this discussion gave rise to a series of recommendations, which we've pasted into the slides. The report is just being prepared for publication, and I think, Bleddyn, you're bound to share with the DHS audience a link to that on the website in the future, so people will be able to get the full roundtable report. But here are just the recommendations. And the first one, the most important one really, the top one, was recommending that immunization should be a focus for the European Commission's One Health mission. We felt that immunization, the vaccination of the population of Europe, was very consistent with the One Health aspirations. And we really felt that it was important that this should be taken forward, and that there is a set of success factors I'll come to in a later slide that we also felt were important to prioritize. So the next slide, please, Bleddyn, takes us to the next pair of recommendations. What we recognized was that there needs to be some commitment at a European level to scaling up immunization systems capability. And we felt that it was important that this should have presidency level backing. Portugal has demonstrated already a commitment to the topic, and we felt that successive presidencies should include immunization information systems as a priority. It's said for perhaps the next 3 years. Why? Because it's going to take time to actually build up the capability of those systems across diverse countries. And we need to complement that by research and consultations on what incentives are going to be needed to help particularly those countries in the amber or the red zones that Tudor showed you. How could they become green? And could this be through funding support, pilot support, mentoring between countries, maybe sometimes things like shared computing power, shared technology solutions, but not asking for the data to be moved. So a number of ways that European countries and the green ones could help the amber and the red ones to move forward. Next slide, please. Then in rather concrete terms, we're not going to have coherence at a European level if we end up with 27 member states each inventing their own totally different immunization information systems. And so we need to see an investment of effort and a commitment towards things like core data sets, the interoperability standards, the data quality standards that are needed to make sure that even if each country implements its own, they are compatible, they can share data, or they can share aggregate statistics and so on, and support cross-border communication in the event of people moving. The WHO was noted as being a body that should play a prominent role in that process, but also noting that immunization information does not live only in the health silo, if you like. It also lives in school silos, occupational silos, and therefore a more cross-sectoral and interagency approach is needed. The next slide, please, Bleddyn. Then we have some more recommendations. One is about connecting to the European health data space. We thought as a group that the European health data space could take immunization information as an early adopting area of content. There is a strong emphasis in the EHDS on empowering the citizen, the patient, and on supporting patient level, individual level data moving at a cross-border level in a seamless, fluid way, but with appropriate governance. And we thought immunization data could be a really early win if this was favored. We also thought there is a need still to build on the OpenSky work. There's a lot that we still don't know, and we would therefore like to ask the Commission directorates to hold more roundtables on the topic. There was recognition of regional health systems playing an important role in some countries, and that they need to be recognized for the roles they would play. And then finally, but actually really importantly, I think everybody in the roundtables felt that one of the most important values of integrated immunization information systems is to empower individuals and sometimes families to have access to their own immunization information and immunization plans. What's next? When and where and what is next due for the patient? And that this ability to offer at European scale this information to individuals is a real win for Europe, that we should be having large-scale demonstrators and look at how this could be an implementation of self-sovereignty in which blockchain might be able to play an important role. So the next slide we come to is who need to be involved in getting this forward. I think the overall view of the roundtable participants was no single stakeholder can achieve this. This is a co-creation, collaboration requirement. And what you have here is a bullet list of some of the agencies that need to be involved. And you know, the penultimate bullet is patient, civil society, and healthcare professional, healthcare provider organization. One bullet, but really it's multiple stakeholder groups hidden in that bullet. So yes, the European level organizations, the world level organization like the WHO, national, regional bodies, but then a number of key stakeholders need to work together. And then the next slide, please, is on success factors. So I mentioned that we saw those. And really, whether you're talking about the data on an individual being shared with the individual and with their health system, or whether you're dealing with cross-border data, or whether you're looking at aggregating data, trust was probably the most voiced word across all of our roundtable participants. Public trust in the immunization systems and in the bodies that are running them, the bodies that are sharing data, so not just the data that the individual has, but all the other information flows going around the ecosystem need to be transparent. The public need to know why they're happening, what they're happening for, and how they are being safeguarded so that their own data protection is maintained, and so on. Another topic was considering the scope of immunization information systems, because we came up with many different functional areas that could be covered, but they might be tough to deliver at once, and there might therefore need to be a prioritization of critical functions that help the red and the amber colors get moving and deliver some immediate added value across Europe. The same is true with the core data set. It could easily become a very extensive data set that maybe we should be forcing ourselves to pick a core that is practical and realistic to achieve. And then, importantly, a little bit like learning from COVID, agreeing how member states will share information about a diversity of aspects, the vaccines, the programs, the screening, incidence and prevalence of diseases, so that we can really benefit from each other's intelligence gathering systems. So these were the really punchline outcomes from the report, and I hope this whets your appetite to see all of it when it's available quite soon. Bleddyn, thank you. I think that was my last slide. And
yes,
now
it was.
It's time to turn to the audience, I think. Yeah. Is that right?
Yes. And whilst we're going to put 3 poll questions for you to answer, so you'll have a link I think, in your chat function. And whilst that's coming up so you can see it and respond to the questions, I'm going to just answer at least one question in the chat already, which was, when will we publish our report? And the report is finalized in the sense of the content is finished. But we're just now going through the process of fine-tuning the layout and making sure that it's as readable as possible. So I would envisage that in the next month, for sure, we will publish it widely. And as Dipak said, it'll be on websites for IHD and for DHS, and we will publish through social media. So there'll be lots of opportunities for people to know that it has come. So I think now you can now see the questions. So please take a look. And whilst we're doing that, I'll also pick up another question, which was, are we aware of which countries in Europe, Tudor, are using the COVID infrastructure to look for flu vaccinations? Have you picked up any of that sort of intelligence in the work that you've been doing? Tudor, you're mute.
Yeah. Well, definitely, it was interesting to see that the COVID-19 experience, it's a benchmark already, which is very good. But the pace of preparing the vaccination campaigns for COVID-19 has not allowed time to integrate the existing systems with the COVID, or the COVID development with the existing system. So at this moment, almost nowhere we have this developments for COVID integrated in the system, but they are trying to do this in some of the Nordic countries. Some of them are quite advanced, but usually it was developed, as I said, as separate, because they had no time to integrate with the existing system.
Okay, thank you. Can we see the results then of? I think go back to the results for Dipak to see for the first poll question.
Yeah, shall I assume now? I think enough people have voted.
Yes.
So I'm looking now at question 1. Which of the following use cases is the most important? And 60% of you in the audience have said that providing access to individuals and families is the most important. Connecting administration of vaccines to the occurrence of complications, adverse events was also ranked. The percentage are still changing a touch. So as I speak, there's a little jump occasionally. And then academic research came third. There seemed to be nobody top ranking a comparison of immunization programs across countries. But that's fine. That's really interesting. And I think that it's very clear that your audience strongly supports giving information to families and empowering people, which is a lovely thing to hear about. Then which are the most important things to you? There are 2 absolutely outstanding winners on that. The first one is vaccine trust. And I know I emphasized that a little bit in my presentation a few minutes ago. I think it perhaps is difficult to decouple from that, whether it's trust in the vaccines themselves. Are they safe? Will they harm me? Will they do good? And maybe trust in the systems that are actually delivering. But I felt that it looked like number 2 was closer to the trust in the systems, whereas number 1 is more solidly about trusting the vaccines themselves. And the second ranked one in our poll is data quality. So really making sure that the information that people are using to make decisions about their own vaccinations or at a national or European level is trustworthy data. And the third one is, do you think you would be supportive of immunization information going into the European health data space? 70-30, more people in favor of that rather than not. So I found that interesting, and I think I was particularly interested. I guess the one that surprised me a bit, to be honest, was the second question, where vaccine trust came over as the strongest issue to our audience participants. And I wonder if I could turn now to our two colleagues. So Cristinela first, and then William, I think, are going to give us their take, not on just the poll, but on the entirety of the content in a way we've been presenting, because they were intimately part of planning and then the actual running of the roundtables and then the report preparation and so on. So Cristinela, do I turn to you first?
Sure. Thank you. Thank you, Dipak, and it's a pleasure to be invited here. At MSD, we've been working with partners as you to support some of the developments in the digital space. As you mentioned, strong and integrated data systems that track vaccination, but also disease surveillance are critical in informing health policy decision making, but also enabling policymakers to make progress towards disease control or elimination of communicable diseases. I'm glad to see that our attendees are all in for patient empowerment. Yeah, patients and the population should have access to their own data to make informed choices and track their vaccination history. But this goes beyond healthcare professionals or patients. It's very important for governments to have the ability to track and monitor to inform decision making. So we have a momentum now in Europe, and as Tudor highlighted, there are huge discrepancies and gaps between countries in the European Union, for example, when we discussed about electronic registry. We have a momentum in Europe with the European Health Data Space proposal, with EU funding as well, and the resilience funds that could support member states, European countries, to address and some of the investment challenges to build up the infrastructure. It's not only about vaccination registries. It's also about how we connect the different registries, how we make sure that the information is available real time to inform healthcare providers, communities, patients, but also decision makers on the status of the medical services in one country. So at MSD, we've been partnering with you in Europe and also with several other organizations across the globe to support development of registries. So one example is the work we are doing in Rwanda, so changing a bit the tone. We've been partnering with Clinton Foundation, but also with the MOH in Rwanda to support the development of their national vaccine registry. Rwanda was the very first country in Africa introducing, for example, HPV vaccination. So we are working for a couple of years now to support the government in Rwanda into building that system that eventually will become the backbone of the patient file. So getting back to your questions, it takes a village. So we need all the stakeholders at the same table to discuss and to align on a minimum data set that could be reflected into the European data space cloud. And why not? We are here as industry to support governments across Europe with our knowledge around establishing the infrastructure that is needed to track and monitor vaccine-preventable diseases. And with that being said, I encourage attendees to be part of the consultation process that Dipak and Bleddyn will be organizing on these matters, and closely work together to to support the establishment of electronic immunization systems. So thank you for the opportunity. And I'm giving the floor to William, maybe.
Thanks,
Yeah.
Cristinela.
William, thank you.
Thanks, Dipak. And pleasure to be invited here to speak with you all. And obviously it was a great pleasure as well working with you, Dipak, and Bleddyn, and everyone on the team in this project and throughout the round tables. I was interested in the poll results there. So there was a couple of things. Providing the individual access to the vaccination record was top of the list. Connecting them with other registries or disease registries and so on, and data quality was in there. Foundational to all of that is the electronic vaccination registry. Without that, it's sine qua non. You can't build on any of those things. If we looked at the heat map, we saw areas of green where we've had long-standing best practice and really strong rollout and implementation of, in this case, HPV vaccinations, which was the focus of our project. And we saw areas of amber and red. Now, when I look to areas of amber and red, I see opportunity. Those areas that were green, that possibly systems were implemented a decade ago, it was much harder to do back then than it is now when we have the prevalence of cloud technologies. We have much stronger and easier to implement interoperability standards on the internet, and also in healthcare where there's simpler and easier to roll out interoperability standards. And if we look at, Cristinela talked there about EVRs and how important they are to policy, even on the day-to-day operational level, I think they're really important. If you looked at a Ministry of Health or somebody who's responsible for, why do they want to do it in the first place? They want to reduce the burden of disease for, let's say, again, let's take something like preventable cancers. And they'll decide that we'll have routine rollout of HPV vaccines, and we might want it, let's say we want an 80% vaccination coverage rate of 11 to 15-year-old children. How do we know it's working? How can we tell that our program is being successful, and how can we tell in real time so that we can modify our marketing campaigns? Or if we're funding these things, are our funding models correct? If it's a reimbursement model, is it a robust reimbursement model that people know about it? Is it working well? If it's a schools immunization program, is it well designed, and are we reacting well? Are our catch-up campaigns properly being implemented to drive that vaccination coverage rate? None of that is possible really in any meaningful way without an electronic vaccination record. And so to me, these things are really, it's kind of the foundational element to all the other things that we talked about in the round tables. And it's where I do see, you mentioned the European authorities and so on playing a key stakeholder role, whether that's an area of standards definition, whether it's funding, whether it's, assisting people in defining that best practice. Because the other point I would like to make is, yes, there's some very sophisticated and intricate systems that are in place in some of those green countries. It doesn't mean that we have to get to that level immediately. Incremental progress can be made, and can be made very quickly, to improve data quality, to improve the rollout of vaccination programs. They do go hand in hand. As we said, they're correlated rather than causal, and but even still, that's a pretty strong statement to be able to make. Yeah, and I think with that, because I'm conscious we've only got a couple of minutes left, so I will hand back to you, Dipak, at this point.
Well, thanks very much. I'm going to ask you both a question, but I'll ask Cristinela to answer first, and then you, William, if that's all right.
Sure.
So I'd like to turn to a question of incentives. There are countries that have had, as William, you pointed out, perhaps a long-standing history of investing. They're now comfortably in your green zone, but a lot of countries are not in the deep green, and some of them are in the red zone. On the one side, that's going to take investment, but on the other side, you've got to look at what are the drivers for that investment. And I think until recently, COVID has been a very powerful driver to get our immunizations up to strength across all of the disease areas for which we have good vaccines. But, and here is now perhaps a rather personal perturbation on the topic, I'm sensing across Europe, and I'm traveling and I'm in another country today, that the COVID anxiety levels are dropping. People are feeling that we've sort of overcome it. And are we now going to be challenged to really motivate countries to invest in immunization information systems and really invest in making sure they are gathering intelligence about outbreaks and sharing that across Europe? Has that momentum passed, or can we still build on the COVID learning? Cristinela, could you tell me what you think about that?
I'm very optimistic. So the momentum,
Okay.
the momentum has not passed. I believe that governments have implemented digital is the new language across Europe now, and digital is and COVID-19 was a facilitator in a way. Of course, it was a pandemic. We all were impacted, but I think that there's still a momentum to build on the learning. And we've seen governments moving towards establishing the call recall reminder systems or healthcare professional apps building on the COVID-19 momentum. So if we work closely with the governments, with in-country stakeholders to drive urgency around building that infrastructure, I think that the moment is now. It's never too late. So, and that's my personal view. From the exchanges we had with governments in Europe, some of the countries are willing to invest in those systems. So we've seen Rees, for example. They recently pledged for HPV elimination, and also connecting vaccination within the integrated system. So I think that there's a willingness to move forward with the investments in the area, but of course linking it with priorities such as the priorities set by the European Commission on eliminating HPV-related cancers.
Yeah, I think Dipak, they go hand in hand. If we're talking to a country who's committed to eliminating HPV, then we're actually that's an investment already before you even get to the digital systems, and we're really going to improve the quality of that investment by having the digital side of that go hand in hand, because it will improve the operational efficiency of the actual rollout of these vaccinations. And it's kind of something I was touching on in my final points there. One without the other, we just cannot reach the operational efficiency of a rollout, and we can't react in real time when, for whatever reason, and there could be a whole bunch of reasons, it could be anti-vax sentiment, could be anything like that. How can we react to that, and how can we respond to things like that so that we don't lose VCR coverage and so on. And the digital systems are fundamental to that. It's going to inform both the operational people and the policymakers to react to that. And, yes, there are investments that go hand in hand with already commitments that are there in terms of vaccination. But in the round, I think it will make the whole thing more effective. And certainly those are the conversations I would like to be having with these individual countries as well.
Thank you. And thank you both for optimistic answers. I know I gave you a pessimistic question. Now, when it comes to making this happen, I mean, the powerful decision-making and probably leveraging the biggest budgets that are needed to make this happen and enabling, if needed, legislation and so on, lives at the level of the ministries and the big power decision makers at the ministry level. That could be national level, or it could be regional level in some countries, and then the transnational bodies like the European Commission, the WHO, and other bodies that operate across countries. Is it inevitable that we have to wait for these top-down decision-making processes to happen, or are there bottom-up things that could be done already to get the show rolling? Let's get William go first this time.
I completely think there's bottom-up things that we can do, because and yes, there's a top-down angle to this as well, but I'll start with the bottom-up because I wanted to say the top-down side of things as well. In most geographies that we're talking about, regardless of whether they're green, amber, red, wherever they are, there's elements of data in every geography, and there's things that can be done with the data that's there today, even if we're not at the level of best practice that we might see in the Nordics and so on. And there's things that we can learn from data that they're capturing, whether it's from insurance systems or reimbursement systems or that will enable us to do some things like targeted marketing, or even things like where there might be infrastructure from COVID that we can provide, reuse or repurpose elements of public facing portals and so on. And I use the word incremental a couple of times because I'm loath to kind of say, let's define gold standards, and then when we've got the gold standard, then we'll bring everybody up to that. That can take time, and that's time that I don't think we need to take. You know, there's incremental progress that can certainly be made. And again, without getting too techie about it, I've mentioned the cloud computing a couple of times and the standards definitions that are there, and they are quite agile pieces of technology. And there's predefined vaccination data sets that are there with things like HL7 Fire and cloud appliances that can be rolled up to enable these things to happen quickly. So I do think, I better move on because Bleddyn has his hand up. I think that's the time bell. Sorry, Bleddyn, go ahead.
Can we let Cristinela jump in with a last remark? Is there time?
Yes, we can, yeah.
Okay, Cristinela.
William captured really, really well. OpenSky has been working with MSD country colleagues and our team into identifying some of the challenges at national level as well. So I really don't have something else to add with whatever William added. They are the experts in the field. So our role and my role is to bring you all at the same table and discuss. So I'm okay with and I'm really happy
That's
to be
great.
part of the panel.
Thank you, Cristinela. So I think then we should close with an optimistic call in a way to the audience and say that given that top down and bottom up both have roles to play, then the simple answer is nobody has no role to play. Everybody needs to get moving on this together. Let's make it happen, Bleddyn.
Fantastic. And William and Tudor, there are quite a few questions. I'm wondering, is it okay if we post your email addresses in the chat so that people can reach out to you? Because I think that there's some interesting, and what I'd say to the audience is, if you have a source of data in relation to vaccination information systems or knowledge, because I know the further work that you're doing, you'd be happy to be contacted by people. So is it okay if we give out your email addresses?
Sure. Yes, Bleddyn, please do that.
Yeah, fantastic. So those people that we couldn't get to, and I'm sorry that we couldn't take all of your questions, but that will give you an opportunity to reach out to the OpenSky team and ask questions and get involved. So thank you for the whole panel. Really appreciate it, and we'll move on. Thank you.
Thanks, Bleddyn. Thanks, Dipak.
Thank you.
Okay. Thank you then.
Bye.
Bye.
Bye.